Welcome to a unique model of long-term care provided in a residential setting called Congregate Living Health Facilities. We are pleased to welcome you into one of the 260 Congregate Living Health Facilities in California. Congregate Living Health Facilities are a small but very vital and integral part of the California long-term care system. CLHFs are mainly 6-bed care facilities, and they are located inside residential care homes, inside residential communities. When CLHFs were established in the 1980s, they were meant to be an alternative for younger, alert, and catastrophically disabled individuals. The CLHF program was created to offer these individuals who wanted to move out of larger institutions and live in community, home-like environments where they could have the best quality of life possible, given their unfortunate disabilities. The CLHF philosophy remains to this day to promote independence and lead as close to a life as the individual used to have before their disability occurred. They remain to this day the only alternative to institutional care for individuals who have gone through life-altering experiences such as motor vehicle accidents, spinal cord injuries, strokes, and many other circumstances that would turn anyone's life upside down.
We were vacationing in Hawaii, and my husband had an aneurysm. He was 38.
I've been in a wheelchair since I was age 3. So I've grown up this way. And to be honest with you, what Congregate provides, because I've been throughout the system a bit, is hope and opportunities. You get to feel like a human. So last week I was at lunch with my cousin who's 21. Now this lady walks up. She goes, "It's so good to see you out with your trach and your respirator. And you're out in life." Mm-hmm. I'm able to do that because of places like this.
Mm-hmm. The CLHF program is funded through the Home and Community-Based Alternatives Waiver since the day it was established. It remains to be one of the only primary funding sources today, but many alternative waiver recipients, such as the low-income vulnerable individuals in the medi-cal state program, are unable to be granted a bed in a Congregate Living Health facility. As odd as this may sound, unfortunately, it is not very uncommon for alternative waiver recipients to have a very hard time finding and keeping a bed in a Congregate Living Health facility. The low-income vulnerable individuals in the medi-cal program of California are having a hard time utilizing the very facilities that were created for them due to the lack of funding of the CLHF program. Since the time that CLHFs were established in the 1980s, they have not had a rate study or an increase in funding. Keep in mind, and I'm sure you know it goes without saying, how much the cost of everything from workforce commodities, administrative costs, and everything else that has gone up over the last 40 years. COVID alone was devastating to the CLHF community. Most CLHFs remained open and continued operating throughout this unprecedented pandemic. We faced many challenges, but continued to serve our patients and kept them safe and free from harm. Today, we continue to serve our residents and continue to face many challenges that are threatening the CLHF community and our livelihood. Because of all these hardships, the CLHF Association, or CLHFA, was born. A group of CLHF owners who recognized the need of unity came together out of sheer desperation on behalf of these homes and those who we serve. We came together to raise awareness of what CLHFs are, who we serve, and why we need the help. And we started this grassroots effort, and together we hope to achieve the best outcomes for our residents and patients. We are the only voice and the only advocate in the state of California for residents who choose to live in CLHFs, and if we do not get the attention and the funding we need, unfortunately, the CLHF model will warp into something unrecognizable and eventually cease to exist for those who need it the most.